Hello, I'm Dr. Graves, and I'd like to talk to you about adrenal fatigue. Welcome to my website, and I'm glad you found me here, and I'd like to cover an important health topic that we refer to as adrenal fatigue. Now, I believe that many of us are suffering from this condition, and it's one of the most undiagnosed conditions, especially of the hormone system in the body or the endocrine system. Conventional medicine does not look at adrenal fatigue as a real condition, and they instead wait until things are so severe that a very low cortisol state exists, and it's often referred to as Addison's disease and represents a medical emergency and requires medication. Now, in between a healthy person and Addison's disease, there is a gradual continuum of decline that happens within our stress or fight or flight system that we refer to as the adrenal glands. Now, adrenal fatigue, what that means is that it's gotten to the point where our endocrine system that produces these stress hormones can't keep up with the demands of life. Now, the adrenal glands primarily regulate the stress response, and stress can come from many different places and hit us in different ways, but I will cover just a few, and that includes emotional stress, toxic stressors, and also nutritional stressors that we encounter. And so stress isn't just worry and going through something very traumatic, but it's also just the activities of daily living that don't keep up or keep pace with the amount of stress that we're under. Now, some very common symptoms that you may experience if you have adrenal fatigue include fatigue. Duh. So fatigue, muscle fatigue, mental fatigue, feeling tired all the time. And on the flip side of that is often a disrupted sleep pattern to where you don't sleep as deeply and as restfully and then have that fatigue during the day. Another common symptom is weight gain. So as this system gets out of balance, cortisol, and it affects other hormones and things in the body that affect metabolism, often we'll see weight and mainly fat gain. Uh, Another one is also sex hormone balance. So in men and women, it could bring on early menopause. There could be a low libido, erectile dysfunction, and low sex drive. And in women, there could be things like hot flashes and night sweats, and infertility for younger women as well. Another common symptom is digestive problems. So the adrenal hormone cortisol regulates the digestive tract, and so when we're under stress, and you might think of when you've been under a very acute stress situation, you often lose your appetite. But it does impact and disrupt digestion such that you may have things like heartburn, constipation, diarrhea, poor assimilation of nutrients. You could also have a disruption in the microflora or the gut bacteria, leading to increased things like infection and pain, bloating, etc. Lastly, the most common symptoms I see are actually things like depression, so mood, uh, anxiety and depression kind of can flip back and forth, or you might be in one category or the other. So it's very common to have either low or even more high-grade levels of depression. So my recommendation is that you would seek out the right care and the right types of testing to address this correctly. And so what you need to do is find a healthcare provider who's asking the right questions. So if you're getting rushed through appointments, if your endocrinologist isn't taking the time to draw and connect all the dots with your symptoms, and your current medication isn't providing the benefits or successful improvements, then you might need to find another provider. The right questions and takes time, so a naturopathic or functional medicine provider would take at least upwards of an hour to go through your full health history and the current symptoms you're having. The next thing is you need to get the right testing. So that goes hand in hand with this assessment to identify the right testing that can identify the core of the issue. And then lastly, of course, is applying, based on all that information, is providing the right treatments to effectively address the cause and get you on track to better health. So I invite you to use our links to select an appointment, and we have a number of plans available for patients who are within the area. And I am in Spokane Valley, but I also consult with anyone anywhere. So if you'd like to do virtual consults, I'm happy to do that as well. So please follow those links. I also will happily accept questions, and I hope to see you soon.